Today we will discuss about non-shivering thermogenesis in the 5-mark short note series. Non-shivering thermogenesis is the process of heat production without any shivering of the muscles. It is the thermoregulatory mechanism in newborns mediated by metabolism of brown adipose tissue under them using sympathetic control as well as hormonal control. So heat regulation in newborns is one of the most important thing you need to understand first. Basically, newborns lose heat easily due to large surface area, thin skin, and lack of shivering. Mechanism of heat loss include conduction, convection, radiation, and evaporation. So what are the mechanisms of heat production? One can be through basal metabolism, the other one can be through muscular activity like crying and movement. Then non-shivering thermogenesis, where the major mechanism is via brown fat metabolism. The physiology of non-shivering thermogenesis. So once there is a cold exposure, there will be hypothalamus activation followed by a sympathetic discharge and a noradrenaline release. So this noradrenaline triggers lipolysis in the form of brown fat, releasing fatty acids which activate UCP1 in mitochondria. Then energy from oxidation is released as heat instead of ATP. Brown adipose fat is a richly vascular and mitochondrial dense. It is found in intracapsular, perianal, cervical, as well as mediastinal region. Mitochondria contains UCP1 that uncouples the oxidative phosphorylation, converting energy into heat. So the hormonal control lies with the thyroid hormone, which increases the metabolic rate and the potential noradrenaline. Corticosteroids through maintain substrate supply. Then insulin, supports through glucose utilization. Overall, hormones sustain the prolonged heat generation. So the clinical physiology. Non-shivering thermogenesis is vital since newborns cannot shiver. This brown adipose tissue develops by 26 to 28 weeks of gestation and is functional by term. Energy and oxygen consumption increases during NST. Hypoxia or hypoglycemia can suppress it, predisposing it to cold stress. Like the failure of NST leads to hypothermia and metabolic complications, which will lead to lethargy, poor feeding, cold extremities, mottled skin, apnea, and bradycardia. So this might lead to hypoglycemia and metabolic acidosis, which needs to be investigated. Expect non-shivering thermogenesis failure in case of preterm hypoxic or hypothyroid infant. Coming to management and prevention. Maintain a warm chain, dry and wrap the baby. Kangaroo mother care, skin to skin contact helps in the management. Maintaining neutral thermal environment in the environment by maintaining 36.5 to 37.5 degrees Celsius and ensuring adequate oxygen and glucose. To summarize, heat generation without shivering is non-shivering thermogenesis. Main site is brown adipose tissue. Mediator is noradrenaline and UCP1. Failure happens, it will result in hypothermia, hypoglycemia, and acidosis. Chain KMC, oxygen, as well as glucose, this can be prevented. It is a vital physiological heater ensuring neonatal survival. I hope you have learnt from this presentation. Thank you.